Good morning, dear friends. In yesterday's lecture, we'll see about the definition of congestive heart failure and on which basis the heart failure is classified, and also which drugs are used in the treatment of congestive heart failure. Now, in today's lecture, we are going to explain about the risk factor, sign and symptoms, and how heart failure is diagnosed, and also their compensatory mechanism. So, heart failure doesn't mean the heart has stopped working. Rather, it means the heart's pumping power is weaker than the normal. That is, with the heart failure, blood moves through the heart and body at slower rate, and pressure in the heart is increases. That is, the heart cannot pump enough oxygen and nutrients to meet the body's need. म्हणजे बॉडीला आवश्यक असणारे न्यूट्रियंट्स आणि ऑक्सिजनची जी डिमांड आहे ती हार्ट पूर्ण नाही करू शकत. ओके, नाव टुडे वी विल सी द रिस्क फॅक्टर or which risk factor is responsible for heart failure. There are the various risk factor which is responsible for heart failure. In that, coronary artery diseases, myocardial infarction, hypertension, diabetes, heart wall disease, smoking, obesity, previous heart attack, congenital heart defect, cardiomyopathy, infection of heart muscle, conduction defect, large amount of salve impact, these all are the risk factor which are responsible for heart diseases or congestive heart disease. In this slide, there is the various sign and symptoms of heart diseases. In that, dilated pupils, skin pale or gray, dyspnea, orthopnea, cough, decreased blood pressure, then weak pulse, enlarged spine and liver, confusion, anxiety, nausea, vomiting, jugular vein distension. These all are the sign and symptoms of heart failure. In next slide, we will see about the how heart failure is diagnosed. If any medical history is taken to reveal symptoms, then physical examination is done. Various tests are done. In that, chest X-ray, blood test, electrical tracing of heart, that is electrocardiogram or आपण त्याला ECG पण म्हणतो. देन अल्ट्रासाउंड ऑफ हार्ट, अल्ट्रासाउंड ऑफ हार्ट म्हणजेच इकोकार्डिओग्राम और इको. देन एक्सरे ऑफ द इनसाइड ऑफ ब्लड व्हेसल, त्यालाच आपण अँजिओग्राम असं म्हणतो. देन आता आपण कंपन्सेटरी मेकॅनिझम बघू. कंपन्सेटरी मेकॅनिझम जे आहे ते 4 प्रकारे असतं. देर आर दी 4 टाइप्स ऑफ कंपन्सेटरी मेकॅनिझम. सिम्पॅथेटिक नर्वस सिस्टीम स्टिम्युलेशन, सेकंड इज रेनिन एंजियोटेन्सिन सिस्टीम ॲक्टिवेशन, थर्ड इज मायोकार्डियल हायपरट्रॉफी and fourth is altered cardiac rhythm. We'll see one by one. Okay, when left ventricular failure or right ventricular failure or both ventricular failure, the compensatory mechanism is when activation of norepinephrine arterial neurotrophic peptide, then the tachycardia is induced, or then it produces further stress on myocardium. Then the congestive heart failure takes place. Then the second mechanism is when activation of renin-angiotensin aldosterone mechanism, the sodium and water retention is induced and it produces further stress on myocardium. Then the congestive heart failure is observed. In third mechanism, when increase myocardial contractility, then the increased cardiac workload, and then cell stretching may observe, and the compensatory hypertrophy and dilation will be produced. Then in next slide, how to work renin-angiotensin system. All about know that how to work renin-angiotensin system. Renin-angiotensin system, when angiotensin angiotensinogen, second is activated, then the peripheral vasoconstriction is produced, and then it increases after load, and when increase after load they decrease the cardiac output and heart failure may observe. In second part, aldosterone secretion is produced, then the salt and water retention may also produce. Then salt and water retention is observed, the edema is produced, and also increase plasma volume. And when plasma volume is increases, increase preload, and then it increases cardiac workload. When the cardiac workload increases, the heart failure may be observed or heart failure is observed. Then in this slide there is the description of how to renin-angiotensin system is work. The RAS or renin-angiotensin-aldosterone system is a hormone system that regulates blood pressure and water fluid balance. We all about know that. When blood volume is low, juxtaglomerular cell in the kidney secrete renin directly into the circulation. Then the plasma renin then carries out the conversion of angiotensinogen released by the liver to angiotensin first. Angiotensin first is subsequently converted to angiotensin second by the enzyme angiotensin converting enzyme, which is found in the lungs. Angiotensin second is a potent vasoactive peptide that causes blood vessels to constrict, resulting in increased blood pressure. Angiotensin second is also stimulate the secretion of hormone aldosterone from the adrenal cortex. Then aldosterone causes the tubule of kidney to increase the reabsorption of sodium and water into the blood. This increases the volume of fluid in the body, which also increase blood pressure. If the renin-angiotensin-aldosterone system is too active, blood pressure will be too high. जेव्हा रास सिस्टीम जी आहे ही जास्त ॲक्टिव्ह होते त्यावेळेस ब्लड प्रेशर पण काय होतो, हाय होतो. There are many drugs that interrupt different steps in this system to lower blood pressure. These are in this slide, these are the diagrammatically presentation how renin-angiotensin system is work. Okay, we'll stop here. Thank you.